Interestingly, the Wikipedia definition of public health practice defines it as the science and art of preventing disease, prolonging life, and improving quality of life through organized efforts and informed choices of society, organizations, public and private, communities, and individuals. It sounds like one of the more complex challenges that I can think of. And to enumerate on those challenges, we thought we had to hear from one of the leading public health professionals in Poland, Agnieszka Gaczkowska. Welcome to the virtual global summit, Agnieszka. How do you balance the science and the art of preventing disease in a time like this?
Well, there's not a lot of space for art right now. I think it's mostly action and science. So I'm not involved right now currently in COVID-19 outbreak prevention in Poland. I can tell you how it works from the community, community health clinic. I can tell you that in my definition, in my opinion, our system is, in general, there is no systems that would be ready for this kind of event. This is some kind of stress test for healthcare systems. It has never been done in modern times on such a big scale. So far, we had only some examples of small epidemics. Ebola was super small, or like SARS in 2003 in China. That was local, actually, comparing to this, what we're dealing with right now. And so we can only compare our preparations for this event, for example, to China, which should be prepared better, right? Because they had a chance to, as quoted, practice on SARS. After 2003, they remodeled the healthcare system and tried to be as ready as it's possible. However, even then they had problems. So comparing that to other healthcare systems that actually never faced this kind of stress test for them, we can only say that we're not ready, and that's for sure. But for the future implications, because I can tell you that I'm more excited about that, because for sure after someone will come out and say, yeah, this is the end, we can go out right now. I believe that healthcare systems will change, and they will be better prepared. There will be bigger investments in R&D. There will be some kind of international and national coordinations for this kind of events, because we have to be aware that this is not the last time. I mean, maybe it will happen next 10 years or 20 years, but for sure the neglected area, because it is a neglected area. Public health is not a sexy sector to invest in.
Healthcare is having trouble getting funded pretty much everywhere.
Everywhere, right? Because it takes a lot of time to see outcomes. It's not very, politically.
And it's a cost.
It's only a cost.
Very good.
In a short time. Yeah, in a short time period, it's a cost. Yeah, but in a short time.
Benefits come over decades.
Exactly. So it hasn't been a very, very desirable place to put the money in for governments. But I think in the next few years that will change, and for sure the bigger money and maybe smarter money, I would say, would go there. So I hope.
So you think
that will
both
happen.
Private and public money, and a lot of it?
Yeah, I hope. It's not only about money. It's more about thinking about it, structurizing it, being prepared. In general, thinking more global, not only local, but also global. So I believe that it will change.
On a larger note, the pandemic has painted a somewhat grim picture of the relationship that a lot of people seem to have with medicine in the specific, but science in the more general, fake news and conspiracy theories instead of facts and the scientific method. Do you think we can shift that?
It's not a new thing. It happened before in previous pandemics. Maybe for sure there was no tools like internet or social media.
You'd think we'd know better, right?
Yeah, you think we would know better. There were plenty of there were some different kinds of fake news in previous times during previous epidemics. But for now, I think it's a sign of times, right? It's not only here, it's in every field, right? It's not only in the healthcare, it's not only during this event. So fake news, it's a bigger problem. I'm not an expert in this, but I think that when we're talking about medicine, we're talking about public health, we always have to look in good resources. I mean, WHO, CDC, these are the places, the information, and they are very well prepared. I mean, they're sharing tons of information. So if you're looking for alleged information, go there, go to this website. Don't look at the link on Facebook wall, because that's just not smart.
That may or may not be true.
It may or, yeah, exactly. The other thing is that, we have to look for like a very realistic information, because it's regarding our health. So don't take actions before checking that at least 5 times, right?
That it will.
Yeah, so because that's your life. Yeah, you have to be.
Agnieszka,
you have to be very careful.
Stay there. I know you're not going anywhere.
No.
Let's bring on our next guest.